name's Kyle. I'm a third year medical student at Griffith University. You know, it's really good to see, you know, to have a lecture from Dr. Bunting and then, you know, come down to the ward and actually see a patient who has the conditions that we just talked about. And I know that, you know, as I said before, you know, other groups aren't getting this same experience, so we're grateful for that. It's also, his lectures are great because they're interactive, as opposed to, you know, the big lecture theatre of 200, 150 people, where, you know, you can actually ask any questions or just talk about the diseases or disorders that are being discussed, and, you know, it's really open and, yeah, non-threatening as well. There's no pressure. Cases are fantastic because it just gives you multiple examples of a particular disorder. For example, I looked at thought disorder in particular, and there was, I think, 4 or 5 examples of a thought disorder, and I got most of them wrong. And this was just after looking at the lecture on thought disorders. So it's so even though theoretically I should know what, you know, to be looking for, you know, to actually see it done in a case is completely different. And, you know, this was just seen evidently when we had the lecture for personality disorder, and then came down to the ward and saw a patient with a personality disorder, and we all missed it. So just having the cases there gives us the chance to practice what we've just learned in the lectures, and really kind of put a clinical spin to what we've just learned academically. It's really hard, I found, when Dr. Bunting's given us the opportunity to actually interview patients, to find the right words to use in a question that will actually get the patient to answer in a way that's, you know, not your words, and in a way that will actually answer the question as well. And these are questionnaires that is, you know, written up in the extension to workplace, makes it just gives us a good guideline, I guess you could say, to, you know, follow these example questions, and that way we can, you know, not trap the patients in our words, which is a really big thing in psychiatry. You've got to try to avoid, because diagnoses can change based on that. Totally for people who don't have the opportunity to sit in consultations with, you know, doctors, consultants or registrars, it would be a fantastic resource. Right now, I actually really want to use it right now, even though I've got all this available, which just shows to me how much I think it's a valuable resource. To me, I know with respect to Griffith, they're pushing recently a big thing into a safe intern level, so that when we graduate, you know, we know what would enough to make us a safe intern. And I feel that this website, Dr. Bunting's, will cover all of the main diseases, disorders, and, you know, clinical cases, and give us, you know, these extensions into workplace. The questionnaires and stuff will all help us to get to this safe intern level, which I feel that isn't really being covered